With that, I'm now going to turn the mic over to Cathy Lieblich from Neighbors Network in Florida to offer her invited commentary. Thank you.
Thank you, Emily. So I'm the board president for Neighbors Network, which is a village in the Orlando area that began in 2013 and became a 501c3 in 2016. I retired in 2022, not that long ago, after 42 years as a social worker, planner, and advocate in the field of aging, and became board president soon after that. Neighbors Network currently is a small village. We only have 45 members and 60 volunteers who provide such services as rides, household tasks, minor household repairs, organizing and decluttering, and social visits. We also offer activities and programs to our members that our volunteers are invited to as well. I'm also on the board of Uplift Florida Network, you heard from Cynthia earlier, which I became involved with because, as Cynthia said, there are only 6 villages in Florida, and I wanted to do whatever I could to increase that number. I've long recognized that in order to sustain our village in the years to come and to advocate for an increase in the number of villages in Florida, research is needed to show the impact of village membership on member social engagement, health and well-being, and the ability to stay living in their own home in the community for as long as possible. So I was really pleased to learn about the Engaging Villages as key partners for Healthy Aging Research Project. I haven't been an ambassador for the project, but did participate in one of the focus groups. I think that it's great that researchers at Rutgers University School of Social Work and RAND are interested in partnering with villages and the village movement to strengthen the research evidence of villages as platforms for healthy aging, and that Emily is not only a researcher, but is involved with the village. I think that's great. Neighbors Network is currently working on our own impact measurement plan that includes both quantitative and qualitative data. All that we have had in the past have been wonderful testimonials, and as Cynthia said before, testimonials are not enough. We have had them from members and volunteers, and we realize that we need more. In order to promote Neighbors Network, secure more members and volunteers, and for our fundraising efforts. Our board vice president, Patty Doust, who is also here today, went to the Village to Village Network website and found under research resources the survey that Emily mentioned. And it was an article that was published in May of 2017 in the Journal of Gerontological Social Work titled Impact of the Village Model, Results of a National Survey. We're currently reviewing the survey questions to see how we might use or edit them to create our own survey to find out what our members and perceived impacts are of their Neighbors Network membership on their social engagement, health and well-being, and ability to stay living in their own home in the community. It was great and really a relief to find this resource, and is my hope that the findings from the Engaging Villages as Key Partners for Healthy Aging Research Project will be a valuable resource for individual villages, hub and spoke villages, statewide village networks, and the Village to Village Network in the years to come.
Thank you so much, Cathy, for such thoughtful and engaging and insightful commentary, and for speaking to how our hyperlocal efforts are all related and build from each other as a collective movement. Really appreciate your work.